23 minutes, 23 minutes to the hour of 7 o'clock. Welcome back to the Now Morning Show here on TTT. I am Natalie Lagore, and on Zoom with us this morning is President of the Downtown Owners and Merchants Association, Gregory Aboud, who was a part of the Confederation of Regional Business Chambers that met with the government yesterday to talk about how businesses have been affected with the state of emergency, with the recent public health regulations, and just how they're going to come out of that. Good morning to you, Mr. Aboud.
Thank you very much. Good morning.
Thank you so much for joining us. So what can you tell us about what happened yesterday at the meeting?
Well, first of all, let me please say that we did not go to meet with the government to discuss how COVID has affected the business community. We, in fact, believe that dissertation of the hardships being faced by all citizens is well known to everybody, including the government. What we went to discuss yesterday was a mechanism or strategy by which we felt we could accelerate our escape from this terrible crisis that we are in. So we actually went and perhaps may have surprised the Prime Minister's team of ministers that he sent to meet us by proposing to them several initiatives which we feel are critical for us to try and find the fastest way out of this crisis and a return to real normalcy. Not a temporary return, but a return to full normalcy for our country. And that is what we really went to discuss yesterday.
And what were some of those initiatives that were recommended to the government?
Well, based upon what we have been told over the last 15 months about the behavior of the virus and the need to interrupt activity and so on, the first recommendation we made was that we felt that a 9 p.m. curfew did not really interrupt anybody's normal activity. The feeling was, and quite unanimous, among the business leaders, and I would say among all those with whom we speak, the feeling is that by 9 p.m., without cinemas and without restaurants and bars, most people are home long ago. And therefore, in order to interrupt the activity that was taking place when this wave of infections and deaths started to occur, we felt perhaps that the government should give consideration to a higher, stronger dose of medicine immediately, maybe perhaps for the next 10 to 14 days, so that subsequently we could see some real significant results. Because as you will probably admit, after 2 weeks and a day or two of the curfew that is currently in place, we have not yet seen any significant improvement in the state of infections or deaths. So a more restrictive curfew and a more restrictive interruption of people's activities was one of the suggestions. Another suggestion was to allow those persons who have the ability to do so to fly out of Trinidad to be vaccinated elsewhere. And once they have those 2 vaccinations, to be able to come back to Trinidad without this arduous, difficult exemption process and the process of arduous quarantine for 7 days at an expensive hotel and so on. It has made it impossible for people to move around. And might I also add, giving people the opportunity to travel and become vaccinated will be a stimulus or an incentive for persons to become vaccinated. In other words, if you were vaccinated with 2 vaccines, you could travel. And finally, allowing people to travel to become vaccinated will assist the government with the difficulty that they currently have in providing vaccines for all of its citizens. It would take away a tremendous burden from the government and also provide persons with access to the vaccine far more quickly. At the moment, we have reports of people waiting for an appointment and being told to come back tomorrow to make an appointment to go and become vaccinated. So other islands in the Caribbean have allowed their citizens to go abroad to be vaccinated. And we feel that this will become an important mechanism by which we could break the stranglehold that COVID has on us. Finally,
Right. Okay, go
finally,
ahead. Go ahead.
we also renewed our request to the government to allow us to assist under their direction and with their permission, the opportunity to vaccinate wider numbers of people, greater numbers of people, including members of the companies that we work at and that we serve and that we run. The fact of the matter is that at the current state of vaccination taking place in the country, 1,500 to 2,000 vaccines a day, how long is it going to take us to vaccinate this population to a stage where we could feel that we have achieved a certain immunity that would allow us to start returning to normalcy? So that was the heart of the contributions that we made yesterday. We think all three suggestions are excellent strategic moves to help the country liberate itself from this pandemic crisis and to help the people that are struggling at the moment because of loss of income and because of interrupted income and for all the other reasons that we have heard so many times since March of 2020. This was the essence of it.
I understand the curfew because I think even I, in my own little private discussions with people who are close to me, thought that, as you said, with restaurants and cinemas and stuff closed, that I thought the curfew hours should have been earlier, and especially on weekends when people tend to want to move about a lot. But let's talk about, allowing people to travel to get vaccinated. I think it has merit. But how do you balance that with a country that has its borders closed? How is it that the business community is also recommending that the borders be open for people to come in freely?
Well, no, we're saying that if you have the two vaccines, that you should be allowed to come in more freely than you are at the moment. This is a very, very cumbersome and depressing state of affairs. People have been locked away, and some people who have been traveling on business all their lives, some people who have business contacts, some people who have business to do. I mean, it has been a very depressing state of hopelessness. People are frustrated out of their minds that you have to send in an application to travel and wait weeks and weeks to hear back from a website.
So you believe the government should do away with that process? Once you're a citizen,
we're not saying do away with. We're not challenging the process. What we're saying is that if you have the two vaccines, look, in the United States and the United Kingdom and in Germany and in all the countries where they have liberated themselves and started to return to normalcy, if you have the two vaccines, 21 days after having the two vaccines, you're no longer required to wear a mask in public. If you look at the NBA finals and the baseball games going on in the United States, they are seating the patrons on the basis of those who are vaccinated and those who are not vaccinated. Persons who are vaccinated can sit in a certain part of the stadium, which, by the way, is the majority of the stadium because a huge percentage of them are vaccinated. And they can sit in that part of the stadium and not wear a mask. I mean, this is a huge departure to see 25,000 people at a basketball game in New York and 15,000 of them are not wearing a mask. All we are saying is, you want to restrict the borders. But why are you restricting the borders to people that have the two vaccines? And why are you stopping people who want to go away and get the two vaccines from so doing? I mean, the point is that if they can afford to do it, it is to the benefit of the country that they do so. Because you would be...
Let's talk about that suggestion, for the business community to help the government with vaccination. Is it that you all are back to the proposal where you all are going to be getting your own vaccines? Or is it that you're proposing that the vaccines that the government already has, that you distribute them amongst your workers?
Well, I mean, no, we don't want to tap into what supply of vaccines the government has recently acquired. They signed up for 100,000 vaccines. But we're a long way from the threshold of achieving protection for our country with 100,000 Sinopharm vaccines and 40 or 60,000 AstraZeneca vaccines. We are way off the limit. We are far from home. What we are saying is that you have admitted that you are having trouble finding the vaccines. You have admitted that you are having difficulty accessing the vaccines. We are saying, give us an opportunity. We are not sure that we will succeed, but we are saying that give us the opportunity with your permission, authorize us to try and find vaccines for the country, and to help in that process. We will contribute in any way you want, either to assist you to dispense the vaccines and immunize people, or to provide you with the vaccine so that you can expand the
So, Mr. Aboud,
immunization.
would the business community stand with the guidelines given by the government, which is it must be WHO approved, everything has to be, would you all stick with those guidelines as to the kind of vaccines you all get into the country if you can?
Of course, who would want to import a vaccine that isn't WHO approved? And who would want to import a vaccine that wasn't Trinidad and Tobago government approved? We are not saying that we want to be given our own authority and autonomy to do this. We are saying, authorize us to help you, authorize us to support you, authorize us to work with you, to add to the vaccine rollout. The country is in a major crisis. There are people dying in ambulances waiting to get into hospitals. There are people dying at home who can't be helped anymore. I mean, the situation is quite critical. And we are saying that we know, and you have told us.
But are there any conditionalities from the business community to helping the government to source these vaccines or to even inoculate people?
What may I ask you mean by that?
I remember the last time we had this discussion, one of the things that was put on the table was a tax break if the business community was to bring in vaccines.
No, that was not the, and may I please respectfully say that it was a tremendous mistake in our opinion, and still resoundingly so among those who know about it in the business community, that the country didn't get the opportunity to take those vaccines. What that business entity was proposing was they had an opportunity based upon their business in another island. They had the opportunity to access a large tranche of vaccines. I think it was something like 200,000 vaccines. And my understanding and the information that we have received is that they said, listen, they would put out the $8 million to buy those vaccines now, and they would hand the vaccines over to the government. And they were not asking the government to pay them back at this minute in time, but if they could be allowed to write off the cost of the vaccines at the end of the year before they settle their taxes, they would write it off against the taxes. It's not only an extremely reasonable proposal, but it is filled with fairness and equity, because we are not asking you to pay us a profit for the vaccine. We are not saying to pay us back or give us a credit in excess of what we have contributed. We have just simply said that we know as a business group that when we sell to you, you take a very long time to pay your bills. So if we are going to contribute $8 million US worth of vaccines, could we please write that off against what we owe you at the end of the year? That is all it was.
Okay.
It was not
Mr.
represented.
Aboud, what was the response from the government towards these three suggestions in the meeting yesterday?
I think Minister Stuart Young was quite open. I think he said that at the beginning of the meeting, that he had come to listen. And I'll be honest with you, he did more listening than he normally does, from the point of view of giving us an opportunity to present our ideas. It was an encouraging environment from that point of view, because I believe that he generally took on board some of the suggestions, and he repeated some of those suggestions in his wrapping up of the session. Mr. Young has asked for written submissions. They took the suggestions at face value and said that once they get the submissions, they would discuss with the cabinet what we had proposed. We are hopeful that because of the seriousness of the situation and the genuine nature of our suggestions, that something will change, and that we would have implementation of some of our ideas. And if those ideas are not implemented, that we would be given an explanation as to why not. But I would say that the government reacted yesterday through Mr. Young and his committee in a magnanimous way, in a serious, considerate way. Mr. Young promised to listen, and I think that he did. And so we're waiting now.
All right, Mr. Wood, we do have to leave it there, but thank you so much for sharing with us, and all the best for the business community. We're all in this together.
Yes, thank you very much. I appreciate it.
You're most welcome. Gregory Booth there talking to us. We're going to toss to a break, but much more coming up in the Now Morning Show. Stay with us.